Your body has been sending quiet warnings for months, and most people over 60 tragically ignore them. One small change in the bathroom could decide whether this story ends in survival or silence. Welcome to Wellness Unfolds, where we uncover the vital health secrets that can save your life and protect your future. For those over 60, the body begins to whisper warning signs that we often dismiss as simple aging or discomfort. Colorectal cancer is a silent adversary, but knowledge is your most powerful weapon against this potentially deadly but treatable disease. If detected early, the survival rate stands impressively above 90%, offering a hopeful future for patients and their families. However, if ignored until late stages, that survival rate plummets to under 15%, a tragedy we must work to avoid. Your colon is a complex engine, and today we will explore 12 specific signs that indicate this engine needs attention. We have categorized these 12 signs into 4 critical groups to help you remember and recognize them before it is too late. Many seniors believe these symptoms are just part of getting older, but distinguishing normal aging from cancer is absolutely crucial. Let us begin with the first group, which involves noticeable and persistent changes in your daily bathroom habits and routine. Everyone experiences digestive issues occasionally, but the key warning sign here is persistence lasting longer than 2 full weeks. The first major sign is a lasting change in frequency, such as chronic diarrhea that does not seem to resolve. When a tumor irritates the lining of the bowel, it can cause fluid secretion, leading to frequent and loose stools. If you find yourself visiting the bathroom significantly more often than usual for weeks, do not ignore this urgent signal. Conversely, the second sign is severe constipation, where a growing mass physically obstructs the normal passage of waste material. This is not just occasional blockage. It is a persistent difficulty that does not improve with diet changes or medication. A tumor can narrow the colon, acting like a bottleneck that makes it increasingly difficult for stool to pass through. If fiber and hydration do not fix your constipation, it suggests a structural problem rather than a simple dietary issue. The third sign is a visual change in the shape of your stool, specifically if it becomes thin and narrow. We call this pencil stool or ribbon stool, caused when a tumor squeezes the waste into a very narrow shape. Think of it like squeezing toothpaste through a narrow opening. The shape is dictated by the restriction in the tube. Do not flush without looking. Noticing this subtle change in shape can be the very first clue of a blockage. This is one of the most specific signs of colorectal cancer, yet it is often the most ignored by patients. To recap the first group, watch for persistent diarrhea, unyielding constipation, and stools that are consistently thin like a pencil. Now we move to the second group, covering visual clues you can see and physical sensations you might feel internally. The fourth sign is the presence of blood in the stool, which can appear bright red or very dark tarry. A dangerous trap for seniors is assuming bleeding is just hemorrhoids, delaying the diagnosis of a much more serious condition. While hemorrhoids cause bright blood, cancer often causes dark blood mixed within the stool, indicating bleeding higher up. Never assume rectal bleeding is benign. At age 60 and above, it requires immediate professional investigation to rule out cancer. Sometimes blood is invisible to the naked eye, which is why medical stool tests are essential for early detection. The fifth sign is a sensation called tenesmus, the persistent feeling that you need to pass stool but cannot. This happens because the tumor occupies space in the rectum, tricking your body into thinking there is still waste remaining. It is a frustrating and confusing ghost urge where you strain to go, but nothing is produced except perhaps mucus. Constant straining due to this false sensation can be exhausting and is a clear signal that something is obstructing the rectum. If you feel the urge to go immediately after leaving the bathroom, report this symptom, known as tenesmus, to your doctor. The sixth sign involves abdominal pain, cramping, or bloating that feels different from normal indigestion, or a simple stomachache. Tumors can block the passage of gas, causing it to build up and create sharp cramps or a distended belly. Pay attention if the pain is localized to a specific area or if the bloating persists regardless of what you eat. Your body may launch painful spasms as the colon muscles work harder to push waste past the growing tumor blockage. When abdominal discomfort starts to interfere with your appetite or daily life, it is a red flag that demands attention. To summarize Group 2, be alert for blood in stool, the feeling of incomplete evacuation, and persistent abdominal cramping. Next, we explore the third group, systemic signs, where the cancer affects your entire body metabolism and energy levels. The seventh sign is unexplained fatigue and weakness, often caused by anemia due to slow, chronic blood loss. Tumors can bleed slowly over months, draining your body of iron and red blood cells without you noticing any blood. This leads to iron deficiency anemia, leaving you feeling constantly tired, short of breath, and pale even after resting. If you feel exhausted doing simple tasks you used to handle easily, ask your doctor to check your iron levels. Doctors often look for pale skin or inner eyelids as a clue, but a blood test is the definitive proof. The eighth sign is unintentional weight loss, where you lose pounds without dieting or increasing your physical exercise routine. Cancer cells are metabolic parasites. They consume a vast amount of your body's energy to fuel their rapid growth. Additionally, the immune system's response to the tumor can release substances that suppress your appetite and break down muscle. Losing 10 pounds or more without trying is a major warning sign that your body is fighting a hidden battle. Doctors consider unexplained weight loss a classic red flag symptom for many cancers, including those of the colon and rectum. The ninth sign is persistent nausea or vomiting, which often occurs in later stages when the colon is significantly blocked. When the colon is obstructed, waste cannot move forward, causing a backup that leads to nausea and the urge to vomit. This is not a stomach bug. It is a mechanical issue where your digestive system is physically unable to flow. If nausea is accompanied by severe constipation or abdominal pain, it indicates a potential bowel obstruction requiring emergency care. To recap Group 3, watch for unexplained fatigue from anemia, sudden weight loss, and persistent nausea or vomiting. Finally, we discuss the fourth group, which focuses on your genetic history and the critical importance of timely screening. The 10th sign is actually a history lesson. Knowing if your parents or siblings had polyps or colorectal cancer. Genetics play a massive role. Having a first-degree relative with this cancer doubles your own risk of developing it. Do not overlook your family history. It determines when you should start screening, often earlier than the general population. Discussing health history can be awkward, but sharing this information is a life-saving act for every member of your family. If you have a family history, your doctor might recommend starting colonoscopies 10 years before your relative's diagnosis age. The 11th sign is the silent growth of polyps, which are small clumps of cells that can turn cancerous. Most colorectal cancers start as polyps, and they can grow silently for years without causing any symptoms whatsoever. This is why screening is magic. It allows doctors to find and remove these polyps before they ever become cancer. Finding a polyp is not bad news. It is a victory, preventing a future cancer diagnosis through simple intervention. The 12th sign is your own intuition, a general sense that your body is changing in ways that feel wrong. You know your body better than anyone else. If you feel a persistent change, do not let anyone dismiss it. We have covered 12 signs, from bathroom habits and visual clues to systemic changes and your vital family history. Remember, having one of these signs does not mean you have cancer, but it does mean you need a checkup. Do not try to diagnose yourself at home. Only a medical professional can determine the true cause of your symptoms. The gold standard for investigation is the colonoscopy, a procedure that is far less scary than the disease it prevents. During a colonoscopy, you are sedated and comfortable, while the doctor examines your entire colon for any abnormalities. The preparation might be unpleasant, but one day of discomfort is a small price to pay for years of life. While watching for signs, you can also lower your risk through lifestyle changes like staying active and eating right. A diet high in fiber from fruits, vegetables, and whole grains acts like a broom, keeping your colon clean. Limit red meats and processed foods, which have been linked by researchers to an increased risk of colorectal cancer. Smoking and excessive alcohol consumption are fuel for cancer. Quitting them is the best gift you can give your body. Maintaining a healthy weight is also crucial, as obesity creates chronic inflammation that can promote tumor growth. Let us review the most critical signs one last time: changed habits, blood, pain, fatigue, and weight loss. If you have noticed any of these signs for more than 2 weeks, please make an appointment today. If you are watching this for a parent or loved one, encourage them gently but firmly to see a doctor. Remember the statistic we started with. Early detection turns a deadly disease into a manageable condition with high survival. Millions of people are survivors today because they listened to their bodies and acted on these warning signs early. Fear of the diagnosis often stops people from checking, but the peace of mind from knowing is worth everything. Returning to diarrhea, remember that watery stool can be the only way waste passes a large, blocking tumor. With constipation, the danger is thinking it is just a slow bowel when it is actually a physical barricade. The pencil stool is so characteristic because the tumor is rigid. It does not move, forcing the stool to change. Dark, tarry stool means bleeding in the upper colon, while bright red usually suggests bleeding in the lower rectum. Tenesmus is a neurological trick. Your nerves fire signals of fullness because of the tumor's mass, not actual waste. Pain from colon cancer is often vague, but if it wakes you up at night, take it very seriously. The fatigue of cancer is deep. Sleep does not fix it because your blood literally cannot carry enough oxygen. Your body is burning calories to feed the tumor, which is why you lose weight even while eating normally. Think of your digestion as a river. If you dam the river, the water backs up and causes flooding upstream. If you are afraid of colonoscopy, ask for a FIT teat test. It is a simple stool test done at home. The FIT test detects hidden blood we discussed earlier, acting as an excellent first line of defense for screening. A positive test does not mean cancer, but it does mean you need further investigation to be absolutely sure. Caregivers play a vital role. Notice if your loved one is eating less, losing weight, or spending time in the bathroom. Keep a simple health diary. Writing down symptoms helps your doctor see patterns that you might otherwise forget to mention. When you go to the doctor, bring your list of symptoms and do not be embarrassed to discuss bowel habits. Doctors have seen and heard it all. Your honesty helps them save your life, so speak openly and clearly. Your health is not just about you. It is about being there for the moments and people that matter most. Colorectal cancer is unique because it is one of the few cancers we can actually prevent, not just detect. By removing the polyp, we break the chain. We stop the story of cancer before the first chapter is written. Thanks to awareness and screening, death rates from this cancer have been dropping for decades among those who get tested. If fear of pain is holding you back, know that modern sedation makes the screening process essentially sleep-filled and painless. Screening is widely covered by insurance for seniors because health systems know it is cheaper to prevent than to treat. Do not let being busy be your excuse. You cannot be busy if you do not have your health. Hydration is your colon's best friend. Water keeps things moving and helps prevent the constipation that masks other issues. A sedentary lifestyle slows down digestion. Try to walk for at least 30 minutes every single day to help. Some studies suggest that vitamin D and calcium may help protect the colon lining, so ensure you get enough. Alcohol irritates the digestive tract. Limiting your intake is a smart, proactive step towards reducing your cancer risk. If you have type 2 diabetes, be extra vigilant as you have a slightly higher risk of developing colorectal cancer. Conditions like ulcerative colitis or Crohn's disease significantly raise risk, requiring much more frequent screening than the average person. Do not confuse IBD with IBS. Irritable bowel syndrome is uncomfortable but does not increase your risk of cancer. Risk can vary by ethnicity. For example, African Americans have the highest incidence and mortality rates of colorectal cancer. The journey from healthy cell to cancer takes years. This long window is our opportunity to intervene and stop it. Talk to your friends. Normalizing conversations about colon health removes the stigma and encourages everyone to get checked. It is never too late to start caring for your health. Even at 70 or 80, screening can be beneficial. We return to intuition. If something feels wrong, pursue it until you get an answer that makes sense to you. If a doctor dismisses your concerns but your symptoms persist, you have every right to seek a second medical opinion. Good sleep strengthens your immune system, which is your body's natural defense force against wandering cancer cells. Chronic stress impacts your gut health. Finding ways to relax is not just a luxury, it is a health necessity. So here is your action plan. Check your stool, monitor your habits, and call your doctor if anything changes. Protecting your health is the best way to ensure you are there for more family dinners, birthdays, and milestones. Avoid charred or burnt meats. The chemicals formed during high heat cooking can damage the cells lining your colon. Ask your doctor about daily aspirin. For some people, it can lower the risk of colon cancer significantly. For women, the risk of colorectal cancer increases after menopause, making screening even more important in your later years. Men generally have a slightly higher risk than women and often develop polyps earlier, so do not delay your screening. Be aware that beets or red berries can turn stool red. Verify it is not just your diet before panicking. Similarly, iron supplements or bismuth medicine can turn stool black. This is a harmless side effect, not internal bleeding. Consistency is key. A one-time oddity is likely nothing, but a pattern that lasts weeks is a message. Knowledge is only powerful when shared. Please share this video with your friends and family to spread awareness. We want to hear from you. Have you had your screening yet? Tell us your experience in the comments. Our community at Wellness Unfolds is here to support you on your journey to better health and longevity. We often worry about our financial assets, but your greatest asset is the body that allows you to live. Let us replace fear with action. Knowing the signs gives you control over your health and your future destiny. Remember, watch for changes in your bathroom habits that last longer than 2 weeks, like diarrhea or severe constipation. Remember, never ignore blood in the stool, whether it is bright red, dark, or mixed in with waste. Remember, pay attention to persistent abdominal pain, bloating, or the feeling that you cannot completely empty your bowels. Remember, look out for unexplained weight loss, constant fatigue from anemia, and nausea that does not go away. And finally, remember your family history. It is the roadmap that tells you when to start your screening journey. Life is beautiful and full of wonder. Do not let a preventable disease steal your time to enjoy it. We are committed to bringing you the most accurate, life-saving health information to help you age with grace. Thank you for trusting us with your time today. We hope this information empowers you to take positive action. If you found this video helpful, please click the subscribe button and the bell icon to never miss an update. Check out these other videos on our channel for more tips on maintaining your health after age 60. We wish you good health, happiness, and the courage to listen to your body's wisdom every single day. This has been a presentation by Wellness Unfolds, your partner in navigating the journey of healthy aging. Thank you for watching Wellness Unfolds. Please subscribe for more life-saving insights and share this video to protect your loved ones.